I'm Erin Ryder, news editor of The Horse, your guide to equine healthcare. We're coming to you today from the Rolex Kentucky 3-day event in Lexington, Kentucky. Our guest today is Dr. Duncan Peters from the Haggard Equine Medical Institute. Dr. Peters, thank you very much for joining us today. Would you mind telling our viewers a little bit about your involvement with Rolex over the years?
Yes, thank you very much for having me. But I am here primarily to facilitate the veterinarians that do this on a year-to-year basis. We supply equipment, we supply time, we supply some manpower, and so we help them do the best job they can.
What we're hoping to talk to you today about is minimizing risk to the eventing horse. Would you mind telling us a little bit about some of the more common injuries that an eventing horse might experience?
Yes, most of them are involved with soft tissue injuries for the most part, and those are related to the speeds they do, especially over cross country, and the training they have to do. Along with that, those are tendon, ligament type injuries that occur, primarily the larger tendons, the flexor tendons or the suspensory ligaments, both front legs and hind legs. We also run into a lot of contusions or trauma type injuries, which as you can well imagine, associated with some of the materials that they tend to jump. So those are the major things, and we tend to deal with those quite commonly. But I would say the biggest concern are the soft tissue injuries.
And what's the role of conditioning or preventative maintenance to sort of try and head that off before they ever start?
That is huge. That's the whole foundation of what these horses are allowed to do. We see them here on this particular weekend, but there are months and months of work that go into maintaining these horses and getting them to the condition and to the state that they can compete here comfortably, adequately, and be competitive. And so that whole work or foundation work involving strengthening the bones, strengthening those ligaments, having these horses being fit to compete is paramount in getting them safely through an event like this.
And once they're here, what are some tactics that riders might use to try and keep their equine partners safe?
Well, I think the big thing is most of them try to stay in the same routine that they have at home. A lot of good warm-up, a lot of good flat work, a lot of stretching, conditioning, and then things like icing and game ready and machines that can help them from a physical therapy standpoint. Massage, good grooming, good muscle work. Some have chiropractic work done, things like that that allow these horses to sort of stay loose, supple, and keep them ready to go. I think the other thing is, under the rules of the FEI, they cannot use any medications. So they are forced at this point to use physical therapy and just good management and good horsemanship.
Are there any particular groups or movements that are working to make the sport a little bit safer for the equine athlete?
Oh, there are tremendous number. Eventing has unfortunately come under some close scrutiny over the last few years, but the USEF has been paramount in that. The FEI, their credo is the welfare of the horse, so they are very, very involved, and there are a lot of horse inspections that make sure these horses are fit, compete, and not injured to work through the event. And then along with that, there are task forces out there under a number of different organizations, the eventing group, some of the other horse welfare groups that pay particular attention and are really trying to keep the sport as comfortable for the horse and as competitive for the riders as they can.
Thank you very much, Dr. Peters.
You're very welcome.